Thank you for your patience. It's been a very lengthy but very productive discussion amongst the Premiers, the Chief Ministers and I, and of course the Chief Medical Officer and General Fruin. First point I wish to make is not only I but all the Premiers and Chief Ministers understand that the challenges currently being faced across the country, particularly in relation to the testing queues, we understand is incredibly frustrating and is highly disruptive, particularly to people's plans at this time of the year. And this is the product of Omicron and the different demands that are placed on the system because of Omicron, which leads to a very high number of cases. So we're dealing with volume challenges as we hadn't seen in other times during the course of the pandemic. But with Omicron, as we know, and as the Chief Medical Officer has set out on a number of occasions now, this is a strain that is less severe but more contagious. And as a result, we are dealing with much higher levels of cases. But as we look through the impacts on the hospital system, which we discussed at length again today, we can still see that particularly in the areas of most acute and serious disease, in ICUs and in ventilated patients, that they remain still at very low levels and well within the capacity of the hospital system. The hospital system challenges relate more particularly to continue to gain access to workforce. That is the key constraint on our hospital system at present, and that relates to a set of rules that are around testing arrangements and furloughing arrangements and isolation arrangements. And we discussed those at length today as we looked at both the demand issues that relate to testing as well as the supply issues that relate to testing and seeing how we can address those. It was also an understanding that we will need to continue to make changes, just as we did in the early phases of the pandemic. Look at the data, the lived experience, and make sure we're continually updating our rules to make sure they're the best possible response that has been key to the way we've handled this pandemic from the outset, using important principles like ensuring that our supports and measures are targeted, that they're well balanced, that they can be implemented using existing distribution mechanisms wherever possible, so the support we provide gets there and we're not inventing new systems that can easily fall apart when you try to put in place a new system, as we've seen on other occasions. We understand that it's applying significant stress to people all around the country, and the further actions we've decided to take today, in addition to those last week where we changed the definition of close contacts, in particular in the isolation requirements, is our hope that, and our confidence that this should further alleviate the pressure which is in the system. The reports that we had today, particularly from Joe Pafoni, who heads up the National Coordinating Mechanism. Joe is also the head of Emergency Management Australia. Joe has been working with the suppliers of the testing products right across the country and working with the industry and working with the states and territories. We're looking at what is a relatively short-term supply constraint because we now have over 200 million tests between the Commonwealth and the states and territories, which they're on their way to Australia this month and next. The Commonwealth alone has 70 million. It was 50 million. We've been able to put in place orders now for an additional 20 million from the Commonwealth. And then on top of that, the states and territories have been getting about their job in supporting the provision of testings within their states. And so those supplies will be on their way. But for the next few weeks, we do anticipate there will continue to be a lot of tension in the system when it comes to the supply and demand of those tests. I also want to stress that this is the same challenge across the world. They're experiencing this in the United Kingdom. They're experiencing this all around the world. There is this rapid increase in the demand for these tests in an Omicron pandemic, which was different to what was occurring in the Delta pandemic. And as a result, the challenges that we're facing here are the same and similar to so many other countries like Australia elsewhere in the world. So we're not on our own in dealing with this. Other countries, most countries around the world, are dealing with exactly the same problems. But what you do when you have those problems is what we've always done in the pandemic. You get together, you work the problem, you get to the solutions, and you push through. That's why Australia is in the situation that we're in after 2 years of this pandemic, whether it is our low rate of death for COVID, the strong economy, or indeed what continues to be, as General Fruin will outline, one of the highest vaccination rates in the world. Want to stress at the start, as we confirmed today, that tests for close contacts and those who are symptomatic, they are free. They have always been free. They are the essential tests that are required for public health management. These are the tests that are recommended by the medical expert panel, the AHPPC. Those are the tests that they say must be done. And so if you are a close contact, as recently redefined, if you are symptomatic, then you need to go get a test from the testing clinic. If you are not a close contact, if you are not symptomatic, you do not need to get a test. That is the advice that we have. And so we need to ensure that we are focusing those testing resources on the essential tests that are required, not the casual tests. I'll come back to those issues in a moment. We also agreed today to remove the requirement for a PCR test to confirm a positive rapid antigen test result. So if you've gone along, if you're a close contact and you've had a rapid antigen test and it's positive, you do not need to get a PCR test to confirm that. That will take pressure off PCR testing lines. Next, there would be a 7-day rolling test that is required for truck drivers. That will be removed. Pre-arrival tests for treatment at hospitals. Now, the good news is that at public hospitals, this is largely not required, likely at all public hospitals. Some of those rules have been changed more recently, but we wanted to ensure that that was standardised. So if you're going into a hospital as a patient for treatment, and we're going to work with the private hospital sector that the same is happening there, that you will not be required to get a COVID test in order to enter the hospital to receive treatment. You will likely be given one when you're there, but you don't need to go and line up in these queues because you're going to get hospital treatment. And we discourage that requirement for people to have tests before receiving even private treatment, even in a GP surgery, where a person is not symptomatic and is not a close contact. No requirement for a second test post-arrival for those who are returning or arriving from overseas. They will have, as we said last week, a rapid antigen test on arrival. If that is negative, then they will not be required to have a further test. Remembering that 99% of those who are turning up at our airports are double vaccinated, and we are not seeing large number of cases come through international arrivals. Cases are community transmission. That's where the greatest risks are. And so there will no longer be that requirement for a second test other than in Queensland, and where Queensland say they will still insist on that until we get to a position of 90% double vaccinated in that state, and that will be done by the Queensland government. All states are moving away from requiring a rapid antigen test for interstate travel. Now, this doesn't apply to WA. WA were not in attendance at the meeting today. They are in a very different situation to the rest of the country. The rest of the country now have case numbers that are on the trajectory of rapid escalation, just like we've seen in New South Wales and Victoria, and they're reporting the same limited impacts on their ICUs and on their ventilator requirements in those jurisdictions. Western Australia will continue, while they weren't there today, to operate as they have been, and we would envisage that when they open their border and they are confronted with these same issues, that they will move into the same system that is operating elsewhere in the country. Queensland and Tasmania will make an announcement when they finally dispense with that RAT test requirement, that rapid antigen test requirement. That will be done in Queensland's case when they hit 90% double dose vaccination, and Tasmania will be making an announcement on that in the course of the next week or so. But I would say, as Victoria and New South Wales confirmed today, that you can't go along to the state testing centre for the purposes of interstate travel tests. Those lines are for people who require essential tests. So if it's not an essential test, you're not a close contact, you're not symptomatic, you shouldn't be in those lines. In most cases, people in that situation don't require a test at all. And they should go to the beach, go with their family, or be at work, or wherever their normal course of business is. So all states are moving away from that RAT test requirement for travel.